Welcome.
We're live. Took a minute. We're having some technical difficulties there.
Apology for the few minutes late.
So that's all right. I think we got it all fixed up. I'm Dr. Wickham Simonds, and this is Michelle Kennedy, a nurse practitioner, and we are live, doing a Facebook Live here at Dr. Simonds Metabolics and Weight Loss in our Raleigh office out near 540 on the Falls of Noose Road. Thanks for joining us. We appreciate that. We appreciate all the questions you've sent in. And we're going to talk about a topic today that I'm real excited about because, well, I've been excited about it for the last 15 years. It's about diabetes and how does that work with weight loss and all of that. You and I get lots of questions. Hey, my aunt or uncle or mom or dad or sister or brother has diabetes or on X, Y, and Z in the way of medication. Can they do this, right? Mm-hmm. So the good news is yes. Mm-hmm. Yeah, this is what you need in most cases. So what do you say we get started on the topics?
Yes, this is a wonderful topic. So we have some great questions. Thank you so much for everyone who sent in your questions. Continue to do so. We do these every 2 weeks. So our first question is, do you help patients with diabetes? And that's from Nia. And I think we just answered that. Yes,
we absolutely do.
Absolutely
do. We help patients with diabetes. I'll say this, just maybe before we really delve into this topic anymore, to clarify, because I think there's some misunderstanding in the lay public about this. There are kind of two forms conceptually of diabetes, right?
Right.
So one form is what's called type 1 diabetes, and I want you to think about that. It's because they're two different animals we're going to be talking about. Type 1 diabetes is a child who is born with a pancreas that cannot make insulin. And since insulin is your body's fat storage hormone, and it's a form of growth hormone, those children can eat thousands of calories a day, and they cannot gain weight. In fact, they lose weight. And so the treatment of that is to give them insulin.
Yes.
That's not the type of diabetes we deal with here, okay? Type 2 or adult onset diabetes, and by the way, they can happen in children.
Originally it was called adult, and now we can't really say that anymore.
That's right.
Because there's so many children getting type 2 diabetes.
That's correct. This type 2 is a disease of excess insulin, not lack of insulin. Excess insulin, okay? Insulin's your body's fat storage hormone. You make a lot of it. What does it do to your weight?
Good fat storage.
That's right. Exactly.
So you gain weight, especially through the middle.
That is correct.
With diabetes.
Yes. So there are a lot of our colleagues who practice this sort of medicine that we practice, refer to it as diabesity. As a result, it's a combination of obesity and diabetes. It runs together in the same pack. Okay, it's a condition of hyperinsulinemia, excess insulin versus the first type, which is no insulin.
Right.
Okay, so when we talk about the stuff we're talking about today, we're mainly dealing with people with the type 2 diabetes, right?
Too much insulin.
That's right.
Yes.
Okay, so yes, thanks for joining us again. Saying hi to Barbara. Barbara, thanks for joining. You've been faithful to join on a number of these.
Yes,
and I really appreciate that. We appreciate you following us. So your diet, look, your blood sugar regulation and your weight, all this stuff is tied together.
Absolutely.
And it's impossible to separate them out. And so America has a blood sugar problem.
Yes.
It's a spectrum. And I know at some point we pick an arbitrary point. We say, oh, this is diabetes. Oh, and this is not. Really, to be honest with you, that's a bunch of bull. Okay, you start getting it way before you reach that point.
Yes,
and it's a spectrum, and it starts in many cases from the time you're a child, or even now, or even more scary, maybe from the time you're even in your mother's womb. Okay, these sort of changes start taking place, and the things that you then eat will manifest themselves later on, right? And so. I like to think of not, we got 30% of the population with diabetes or whatever. I want to say that 75% of the population has some form of glucose regulation problem, an insulin problem, and that's who we're treating, right?
Exactly.
So I don't know that, I realize that in medicine we use these terms, diabetes. I would just say that most everybody you know has some problem with it. And that's the way I like to look at it. And the way out of this problem is the same, right?
Exactly. And going back to the fact that insulin is really the issue. We call it a blood sugar problem, but really it all starts with insulin. And the blood sugar is just kind of an innocent bystander that gets blamed for everything. But controlling insulin is really the goal. And in that, you will then control blood sugar, and then you will not have the complications.
That's right. Yeah. The blood sugar is a good surrogate marker of insulin.
Yes, that's what we
check. But really, insulin's the issue. And so I want you to go back in your mind historically. And because a lot of these questions we're getting are going to kind of come together when you understand this. We come from ancestors who, I know you may not believe this with your modern American mindset, right? But there was no Harris Teeter or Food Line down on the corner. There really wasn't. There was not a fast food outlet of any kind. There weren't even factories to refine these foods, okay? So what our ancestors ate was they ate animals. They ate what came from animals, and they ate what they could grow, and they couldn't process it, okay? So this is what your DNA is adapted to. You got that from your ancestors. This is what they ate, and they ate it for many, many, many years, and your DNA is adapted to that. So when you think about those things and the amount of physical activity, it's not like they had an automobile they could ride around in. Many of them didn't even have a horse they could ride on, okay? They were walking in a lot of places, building their own houses, building their own roads, all of these sorts of things. It was hard work, and they were eating things that did not spike their blood sugar, right? So if they didn't spike their blood sugar, then they didn't have, that's right. So our ancestors made a tiny amount of insulin. And every depiction you see of our ancestors, they are rather lean, okay? They're lean, right?
Yes, they are.
They were not big people, and this is the reason why. We come along, and I'm telling you that the modern Western mindset, people don't consider these things, and they just act like, okay, we're going to introduce into the population all this refined grain for, not only is it genetically different, but now you're refining it down to a fine powder, for example. Okay, and you're going to introduce that and refined sugar. You're going to genetically modify fruit to produce way more sugar, and then you're not going to be physically active like that.
It's a recipe for disaster.
It is a recipe for disaster, and the disaster has been taking place for quite some time.
Yes.
And so,
absolutely.
And unfortunately, this is sad to say. But many larger organizations and governmental authorities double down on what I call stupid. They double down on stupid and continue to recommend this in the face of mounting evidence that it was not true, and they silenced people. They actively silenced good people, thought leaders, who said, wait a minute, I don't think this is a good idea, right? And this is a stain on our historical record. There's a lot of things that are a stain. Slavery was a stain on our history. This is another stain on our historical record, because what it's done is it's made a lot of people sick. It made them think that they can go out and eat these things. And the results have been coming in now for 40 and 50 years. And guess what?
It ain't good.
It's bad, right? It is the American health problem, and it's driving all of these costs. I always say if we never would have done this stuff, we'd be paying 1/4 on the dollar of what we pay for healthcare in this country, and we would be a lot leaner and we'd be a lot healthier. But instead, we continue to intellectually go through the exercise of how can we pay for all these expensive treatments without ever changing what we're eating. So we're in the business of saying, hey, we got to get back to eating the right way to get our bodies to work right, so we don't have all these health problems. Right?
Absolutely.
That's the way out.
Absolutely. And it's up to us. This is kind of got to be a grassroots effort from the bottom up. The money you spend on certain foods is how you vote. So when you're buying from farmers markets instead of a bunch of Kellogg's and Coca-Cola products, you are voting with your dollar to try to change our food system. But luckily, we do have a lot of farmers markets and co-ops and places you can get fresh food locally. So you don't have to kill it yourself, fish it yourself, grow it yourself. Other people do that for you, but you can cut out that middleman with the grocery. So thanks for joining everyone who's recently joined. Right. We see that you're coming on. We really appreciate it. We're talking about diabetes and weight loss today. We're given a lot of background here. And Nia's question about, do you help patients with diabetes? We addressed that. Yes, we do. And I will say, even though we do not treat type 1 diabetes in our practice, if you have type 1 diabetes, you can come. I have several patients who do, and we are just much more cautious, as we are with everyone, about the medication that they're taking and making sure that their blood sugar stays in a very healthy range, just like everyone else. So don't think that just because you have either type, you cannot come. Weight loss helps both, and all of the potential comorbid conditions or, conditions that come along with the diabetes, either type.
So Jenna's got a question here, and given on the background that we've just given, she says, I've got diabetes. I've been encouraged to lose weight. What are some of the things that I need to consider? Okay, well, I think there's a couple things. So, Jenna, if you're a patient of ours, you need to talk to us about maybe any medication you're on to lower your blood sugar. Because as we go into a diet, if we recommend a diet to you, it may naturally on its own lower your blood sugar. And then if you're on medication that lowers your blood sugar further, your blood sugar can get too low. So we've got to watch out for those things. And those are things that we want to identify about your current medications, right? We call that a metabolic assessment. And some of those medications, by the way, that lower your blood sugar are famous for making you gain weight also.
Absolutely.
Okay, they actually increase your insulin levels, make you gain weight, and that may be the reason you're having a problem losing weight.
Vicious cycle.
Yeah, so we got to kind of deal with that. But look, you do need to lose weight because the fix for type 2 diabetes is losing weight. It will make this problem much better or make it go away altogether. And it can be controlled by your diet and your lifestyle if you know what to do and you're willing to commit to the ideas. And we can give you medicine to help you pull that off, right? Things to help control your appetite, for example.
Yeah, and I think that was a really good thing. You said it very quickly, but we can make it go away altogether. We do have many patients in our practice who went from being, via lab work in a range to have diabetes to going into a lab work range to not any longer having diabetes. So they are basically in remission. They have reversed their diabetes. And that may not be the case for everyone. It does depend on the level of your disease, maybe how long you've had it before you've gotten help, but it is really exciting to be able to tell people, you don't have diabetes anymore, or you don't need that medication for your diabetes because your diet and your lifestyle is your medicine.
That's right.
And we do that with blood pressure as well, and that's part of the metabolic assessment is, are you on any medications for any other conditions that we are going to need to take away, which is a great thing, right? It's kind of the goal.
That's correct. Yeah. Right. So this kind of ties into the next question from Terrell, which is, I've read that the keto diet can help with diabetes. Okay, so in light of the previous question, what are some of the things I need to consider if I'm a diabetic? So go back to that topic. A ketogenic diet is a diet that restricts carbohydrate intake. That's the very first fundamental thing. When you restrict carbohydrates are things that raise your blood sugar, okay? And so sometimes patients get confused. They think carbs mean pasta and potatoes. That's not what I'm talking. That's part of the carbohydrate. A carbohydrate is anything that raises your blood sugar. It includes candy and sodas and sweets and all that sort of thing. It includes rice and potatoes, even quinoa and brown rice and things that
grains.
Quote healthy, right? So I'm going to say every form of sugar, including the sugar that's in fruit, okay? Every form of grain, so whether it's breads, crackers, cereals, noodles, oatmeal, I don't care whether it's whole
brown
grain.
or white. Right?
Color doesn't matter.
Distinction.
Whether it says whole grain or not, doesn't matter. And then rice, potatoes, and beans are the starches, right? So those things can all raise your blood sugar, and they're going to raise your insulin level. They're going to keep you in that fat storage mode. So that's really what we're trying to get out of there with the keto diet. Now, you can argue about a proportion of fat to protein and all this stuff and the remaining calories that you eat. But if you don't ever address that first issue, you've not addressed the core issue, right? And this is the American diet is the failure has been that it is a high carbohydrate diet that is deficient in protein and fat.
Absolutely.
That's the bottom line. And we got to reverse that to get back to the diet of our ancestors. it was a diet high in fat with some protein and much lower in carbohydrates. That's just
and
what
carbohydrates were whole and unprocessed.
Yeah, exactly.
It was not a process.
Exactly. So, I mean, yeah, I mean, it's pretty hard to argue with that stuff. And this is what you're adapted to. And what we find is that when we can get people to do that and to replicate that, their blood sugars normalize, their lipid panels get much better, their blood pressure gets better, and all these inflammatory processes improve.
Yeah.
Okay. And their weight does what?
Goes down.
Bingo.
Yeah.
Right. Now, it's easy to talk about that.
Mm-hmm.
I always say if it was easy to do, it's just talking about them, America could be thin, but we're not thin. Many of these foods that have the carbohydrates in them are quite addictive. They act on addiction centers in your brain, and there's a lot of emotional attachment to them, and so on and so forth. And this is the reason that I prescribe medications to help control your appetite, to bring that stuff under control, so that you have a plan in place of here's how I'm going to eat, you can actually pull that off.
Absolutely.
Yeah.
Yeah.
So yes, the keto diet it is the fix
Yes.
to diabetes,
Yes,
right?
It absolutely is. And as a patient in our practice, we'll help guide you again if you're on medications, if we need to change anything about your diabetes treatment plan, which we will, and we usually do pretty quickly, because the ketogenic diet is not only powerful, but it's like within a week potentially it could be powerful at lowering your blood sugar, lowering your insulin, and needing to have adjustment to your medication. So it's something that, please talk to us. If you do want to do a keto diet, Terrell or anyone else.
Yeah, that's right. And by the way, we'll work with you if you're not doing a keto diet. The weight loss still helps your diabetes.
Yeah.
It won't be as profound as with the keto diet, but it will still help. And we will definitely work with you on that. We're not going to force you to do something diet-wise that you aren't in agreement with or don't want to do.
That's an excellent point. Yeah. Generally, as long as you are, ready to partner with us, we will work with you. Right. So don't feel like you have to do a certain thing. So moving on to Amy's question, she brings up a med that we use a lot in our practice. She says, I'm currently taking metformin for diabetes. Will my medications need to change if I work on losing weight? And metformin is a medication we've talked about on previous AMAs, and we use a lot because it is powerful at lowering insulin. And kind of the theme of a lot of our AMAs comes down to when you make too much insulin, the goal is to make less insulin, and lower carbohydrate, anti-inflammatory, whole food consumption helps that, as does metformin.
Right. Yes.
And metformin luckily does not, as long as it's not given with other medications that also lower blood sugar. So we'd have to see if you're taking anything else. But by itself, metformin does not come with that risk of the blood sugar drops. We call them hypoglycemic events, right? We had a dip in your blood sugar, you get shaky and nervous. Metformin does not do that. So we don't usually not stop the metformin when you're on a weight loss journey. Again, that will be something that we discuss with you as your medical provider. But generally speaking, metformin is continued throughout the weight loss journey. Do you agree?
I do agree with that. I think it is an excellent, unlike, say, some medications where a company will come up with a chemical compound that's useful at treating a condition. The active molecule that's in metformin is something that occurs naturally in nature. And so you can think of it as like a supplement. Mm-hmm. If would you take a vitamin supplement from the vitamin store for a long period of time? And many of you would. And so the information that is, I would say, if you've read information on the internet that metformin is bad, that is incorrect.
Yes, there is a lot of stuff out there about that.
Good. Metformin is definitely good for a lot of things, and I think that it is turning out to be something that is a real diamond in the rough.
Absolutely.
And more and more physicians are coming around to the idea that, well, I'm being a little bit facetious here, that we need to have metformin in the water supply, essentially, right? It is associated with many good health parameters.
Now, we've used metformin for years. Mm-hmm. We prescribe it for many of our patients. We are very comfortable with it, very familiar with it, and can guide on the dosing because it can have some stomach upset associated with it. And a lot of people just associate a certain type of metformin that's called immediate release that gives a lot of stomach upset to everyone not being able to tolerate it. But we usually use a slow release version. We start at a low dose and we work with you to go up on the dose as tolerated, not by a set schedule. So there are correct ways to introduce metformin or to continue metformin or change the dose so that you avoid any of the side effects associated with it.
That's right. So the answer to your question then, Amy, is you will not need to quit taking metformin to try to lose weight. We want you to take it while you're trying to lose weight. It's going to help you do it. Yeah. Pair it with the right diet. It'll help you lose weight faster, in our opinion. So that's what we want.
Yes.
Now, the next question is from Grace.
Yes. Grace is asking, since diabetes runs in her family, she wants to prevent getting it. Is it preventable? Yes.
Yes, it is. It is, in fact, preventable.
Yes.
It is a disease of dietary carbohydrate excess.
Yeah. It is a modern disease as well. We did not have type 2 diabetes in our ancestors that were hunter-gatherers, the people who were growing their food. It is not a disease that developed that. Most of our diseases are modern, but type 2 diabetes especially is only because of how we eat now. So it is absolutely preventable. Even if you have a lot of members of your family who suffer from diabetes, that does not mean that you have you're sentenced to get it, that it's inevitable.
That's right. This is a pet peeve of mine. I said that this is all a spectrum, whether you call it diabetes or not. When Michelle and I go meet with other doctors who do what we do and real experts in the field and do continuing medical education, we meet academic minds from around the country who talk about this. They don't sit here and think about it in terms of diabetes or not diabetes. They think about it in terms of glucose and insulin regulation, and the dysfunction begins really early, right? So when you consider that as your definition of the glucose insulin problem, 3/4 of Americans have it, okay? So I see now that maybe there are, experts argue about using the definitions, does half the American population have this metabolic syndrome, which would include the glucose dysregulation? Maybe it's 2/3. Okay. Well, I like to talk about this in the era of the coverage of coronavirus, because the word epidemic and pandemic has been thrown around, and I am absolutely put out by the sensationalism this gets. Meanwhile, 2/3 to 3/4 of the population has a disease that's going to take them out a lot more slowly and give them major medical problems along the way. And it's going to take them to the grave early. And we act like it's not a problem and like this is somehow okay.
Right.
Yeah. Look, I'm not minimizing what coronavirus or influenza can do, because it kills a certain number of people, but it kills way less than what this disease produces over the lifetime of individuals. And so I just wish that we would spend as much time focusing on this sort of thing, because look, you and I have been, particularly me, but you've been aware of all this healthcare debate. How are we going to cover all these people, and what's the American healthcare system, and it's good, bad, or whatever, and all these people fight about it. And meanwhile, this problem, which is driving it, is going on, and it's like, hey, no one wants to talk about it, right? So I'm over here like hitting the cymbal and the clang. Hey, wake up, you morons. Let's start talking about the real issue, right?
Because it's preventable and treatable.
It is absolutely preventable, right? And so you don't want to gain this excess body fat. That's the name of the game. And as we kind of get toward the end of this broadcast, this is kind of a good point to kind of drive home, is that you do this with diet, and you can prevent this with diet. You don't have to have this.
Yeah.
Just because your parents had it, your grandparents had it, you don't have to have it.
Right.
Okay. It's about what you eat, and you got some decisions to make. And you talked about where you shop and how you vote. These are decisions you can make now, and you don't have to go down that road.
Absolutely.
I want to say, don't be a cattle in the chute, unable to look from side to side.
No.
Start looking from side to side. Start asking questions, right? All right, let's start let's pick a different destiny.
And that's what we're here for, to help you on that journey, because it's not easy and not a lot of people are doing it. So, we will partner with you to help. We're open, give us a call. We are here to help. We have an office in Raleigh. We have an office in Durham. If you cannot come into the office or do not feel comfortable, we will do your visit over the phone. We have a pharmacy on site. I mean, we really try to make this as convenient as possible. And you can visit us at simonsmetabolics.com. Now, before we wrap up, we have one more question I'd like to address from Andre. He is currently taking insulin for diabetes, wants to be a patient. Is that possible? Yes, absolutely.
Yeah,
absolutely.
That's right. Yes. So we want to help you get you off that insulin.
Yes, that would be the goal.
That's right.
That would be
the goal, insulin absolutely. Is a very weight positive medication. It's going to keep you from losing weight. 90% of the patients we see, we can wean them right off of that with just a low carb diet. It controls your blood sugar. When your blood sugar is controlled, you don't need all that insulin, right?
Exactly.
And as the insulin comes down, then you really begin to lose weight. And I've had male patients, Andre, lose weight. I've had guys lose 100 pounds in 6 months and completely be off their insulin. It's not unusual.
Yeah, we've had that. Yeah,
that's right.
Raleigh as well.
So it's definitely doable, and it's very liberating. It's very liberating.
Absolutely, especially when you learn you do have control with your lifestyle to modify not just your weight, but what medications you take for other conditions and your energy and whether you can keep up with life and be happy. I mean, we see people, whether it's keto or any other diet, not only do they lose weight, but they're happier, they're more energetic, they enjoy life more, they feel more in control. There's so many of these non-scale victories that we have to celebrate. And, with diabetes being the theme and being so common in our population, that's a huge victory to go from having it to not having it, or having complications of it to not having those complications. And it's really important to address and continue to talk about. And that's why we do these every 2 weeks, so we can talk about the things that are important to us and important to you, as our patients and our followers. And please keep sending the questions in. We want to hear from you and what you need from us.
Yeah. So anyway, we want to thank all of you for tuning in. This is the end. One of the things a final thought to leave on, one of the empowering things, Andre, if you get off that insulin, right? I think people don't realize once you're on insulin or these other oral hypoglycemic medications, and you're able to come off that and your blood sugar is normal and your hemoglobin A1C comes down to normal, you realize you had the mindset of a sick person. It's psychologically very damaging. It's a black cloud over your head. It's just like a rain cloud sitting right there ready to dump on you all the time. You're all the time thinking, I'm sick. And you don't consciously think about this, but you begin to get this sort of mentality about yourself. And you get out from under that when you realize, hey, I don't have to go to the doctor every 2 weeks to have all these tests. I don't have to go to the pharmacy all the time to pick up a medication. That stuff is ruling my life. And now it's not. It's a really great reason to lose weight. So thanks for joining us. We're open during the pandemic. We're open to treat the real pandemic, which is glucose and insulin dysregulation, right? And you can visit us on simonsmetabolics.com, visit any of our social sites, on the Casual Keto Doctor site, and on the Casual Keto Doctor Instagram site. Thank you so much for attending, and we'll see you again in 2 weeks.
Have a great week.
Okay.